Friends, in this era of information technology, reality shows, singing competitions, you must be getting a lot of voice professionals in your clinics. So welcome today to this interesting session on professional voice to explore the wonderful gift of communication, our voice. Voice not only conveys message, voice also conveys emotions. Voice creates personality, voice creates aura.
आज मेरे पास बिल्डिंगें हैं, प्रॉपर्टी है, बैंक बैलेंस है, बंगला है, गाड़ी है, क्या है तुम्हारे पास?
A newborn child is born with a sound, but he gets the first lesson of music from the mother's lullaby and the chirp of the birds. The first lesson of tal, rhythm, comes from the cradle. Voice is produced from vocal cords which are hanging in the neck. Voice is not the product of only a small machine hanging in the neck, but voice is the product of many small machines working in close, coordinated fashion like this. And it is this orchestra which is the professional voice. So, professional voice users are not only singers and actors, even politicians, teachers, call center employees, lawyers, doctors, receptionists, they are all professional voice users. However, singers and actors are athletes in the voice world. The problem of the professional voice users are almost always benign. They are rarely surgical. They are very small problems in voice, but they require a sophisticated analysis by trained personnel. Therefore, a dedicated professional who has got a better understanding of anatomy and physiology of voice production, who can devote more time, and who is better equipped with instruments and experience in handling celebrities, who is also having an artistic bent of mind along with the scientific approach, is always welcome. Voice care is today where otology was around 30 years back. So let's see what is the voice machinery in the human beings. It has got a power source which is the lungs. It has got an oscillator with the vocal cords in the larynx. And it has got a resonator which is in the neck and the sinuses. So let's start with the basic of voice, the oscillator, the larynx. The larynx consists of few bones, few cartilages and few muscles. On the top of the larynx is hyoid bone, which helps the larynx to be suspended in the neck. And the rest of the cartilages and the muscles hang from the hyoid like this. The thyroid cartilage is the framework, is the main cartilage of the larynx. The cricoid cartilage forms the base of the larynx. On which the whole larynx sits comfortably. The muscles of the larynx are classified into two groups, extrinsic and intrinsic. The extrinsic muscles help to move the laryngeal framework, the thyroid and the hyoid bones, and the cricothyroid muscle which connects the cricoid and the thyroid cartilages are the most important. The cricothyroid muscle is very important in singers when they want to attain the high pitch because it elongates the vocal fold by tilting the thyroid cartilage forward and downwards. As you can see here, when cricothyroid muscle contracts, the thyroid cartilage is bent forwards and downwards. So, see what happens when a singer tries to achieve a high tone. You can see the lengthening of the vocal cords, which is affected by the cricothyroid muscle. Vocal ligaments are the paired elastic bands that extend from the vocal process of the arytenoids to the inner surface of the thyroid cartilage. What is important to understand is vocal ligament is not vocal fold. The vocal folds consist of vocalist muscle, vocal ligament and the mucosa. So vocal ligament is the name for the deep layer of the lamina propria. The vocalist muscle has got two parts: the internal thyroarytenoid or internal vocalis, which helps to stiffen the vocal ligament, and the external thyroarytenoid or the external vocalis, which pulls the arytenoid forward, thereby increasing the thickness of the vocal fold. So in combination, the vocalis muscle can have various actions, and by these a voice professional gets all the abilities to maneuver all kind of pitches and loudnesses as he wants. Coming to the arytenoids, they are the paired cartilages which are responsible for the motions of the vocal fold, medial to lateral. Most of the muscles acting on the vocal fold are attached to this arytenoid cartilage. As you can see here, the fine control of these muscles finally decide where the vocal folds are going to rest in which part. And a fine coordinated movement of the arytenoids and the thyroid cartilage along with the extrinsic and intrinsic muscles finally decide the pitch, the loudness, the emotion, everything which is installed into the voice. Almost all the muscles attached to the arytenoids are adductors of the vocal folds. That means they bring the vocal folds together, except for PCA or the posterior cricoarytenoid muscle, which is the abductor, or it moves the vocal folds apart. One of the most important adductors is the LCA or the lateral cricoarytenoid. The others are the transverse interarytenoid, which causes the superior closure of the posterior glottis in addition to adduction of the vocal folds, and the oblique interarytenoid, which causes the medial closure of the posterior glottis and adduction of the vocal folds. The PCA muscle or the posterior cricoarytenoid, as we just discussed, is the one which keeps the laryngeal inlet open. The arytenoids are also called the lifeline because if the movement of adduction does not take place when you are eating something, you will get choked. And if they do not open when you are breathing, you cannot breathe. So it's very interesting that the small cartilages at the back of the larynx are the lifeline of the whole human body. And this is how the whole larynx moves with the extrinsic muscles. Apart from this, the position of the larynx in the neck is also decided by strap muscles and the constrictors of the pharynx, such as during swallowing, the larynx gets elevated, and also during high pitch phonation, the larynx is elevated. If you have to produce a pitch like E, the larynx goes up. But if you have to produce a sound like E, the larynx goes down. Okay, now let's see how sound is produced. In order to produce a sound, I have to take a lot of air in and then leave it out from the small glottis. So my lungs is the bigger balloon in which I fill up the air and then leave it out like this, and it passes through the small chink called glottis. When this air passes through the glottis, it sets the glottis into motion, called mucosal waves. As you can see here, when the air at a high velocity passes through this glottic chink, it presses the mucosa apart, and when it has already passed, the pressure drops. Thereby, because of Bernoulli's phenomenon, the mucosa is pulled back inside. This cycle is called mucosal wave. According to the body cover theory of the mucosal wave formation, the vocal folds are made up of 5 layers: the epithelium, the 3 layers of lamina propria called the superficial, intermediate and deep layers, and the muscularis. The epithelium and the superficial layer slide on the deeper layer and the muscularis. So the deeper layer and the muscularis act as the body, whereas the superficial layer and the epithelium act as the cover, and between them is the jelly-like space called the Rynkes space. This mucosal wave travels on the top of the vocal fold like a wave of a sea. But since the vibrations happen very fast, our eyes cannot see it independently or individually. Our eyes can only see separate images up to 20 Hz, that means 20 times a second. Beyond 20 Hz, the images are seen as one. And to see them separately, we need a technology called stroboscopy. The stroboscope has a light source which illuminates according to the frequency of the sound, and every illumination is given at the peak of the light wave. If this is desynchronized by 2 to 3 Hz, then we get image which is not seen by the naked eye, and the image is like this. As you can see here, this is the paradox which has been created by the stroboscopic light. We can see the slow motion images of the vocal folds which are actually vibrating at a very high speed. So the application is that if in this case of a singer's nodules, we can see that there are nodules on both the chords. But if we see them with the stroboscopic image, we can see the vocal fold lips separately, and we can assess that the nodule is present only on the superior lip, it's not there on the inferior lip, and that the mucosal waves are present. This is a soft nodule and there is no need to operate on it. While doing stroboscopy, we look for the criteria like glottic closure, free margin of the vocal folds, supraglottic activity, vertical planes of the vocal folds which are even or uneven, but the most important is mucosal waves. And in the mucosal waves, we see whether they are present or absent, symmetrical or asymmetrical, regular or irregular, their amplitude and the non-oscillating segments. So in this case, you can see that there is almost no mucosal wave. This is the case of a vocal fold scar. Here you can see that the right chord looks normal, but on the left chord there is a small adynamic segment in the mid chord level. This is again a vocal fold scar, which is causing a pitch problem in a professional singer. If I see a polyp which is obstructing the glottis to close, and I see the waves present on both the sides, I know that the moment I remove this polyp, the patient's voice will come normal. If I see nodules which are obstructing the mucosal waves, they are the surgical nodules. In this case, actually on the left chord you can see a vocal fold cyst with a reactive nodule on the right side. These are true hard vocal fold nodules which require excision, and since the rest of the chord is not scarred, we can assure a good result after surgery. Whereas the soft nodules do not have to be operated. Like this hemorrhagic polyp will give a very good result after excision because the mucosal waves are present on both the chords. Muscle tension dysphonia is a disorder in which, because of excessive muscle tension, the voice is not coming out properly, the mucosal waves are shortened. Another condition is sulcus vocalis, where there is a sulcus present on both the vocal folds, resulting in less mucosal wave formation and a bad voice. You can have combinations, like in this case on the right chord you can see intracaudal cyst and a grade 1 sulcus on the left chord. Sometimes it is difficult to distinguish between a scar and a sulcus, though the management does not differ too much. Another interesting condition is puberphonia, in which a man talks like a woman. You can see that the mucosal waves are normal and puberphonia is only a state of mind. With proper speech therapy or voice therapy, the patient's voice returns to normal. Rhenke's edema is a condition in smokers, and many a times professional voice users have a small nodule which is hidden, as you can see here. Early leukoplakia versus late can be differentiated very well on stroboscopy, and this differentiation is very important because in professional voice users, saving the voice becomes important. Here in this case you can see that the left vocal fold is still vibrating but the right one is not. So during surgery, you take a biopsy from the right chord, get a frozen. If it is negative, do a good micro dissection respecting the vocal ligament. Use as less laser as possible and you can get satisfying results after 6 months to 1 year when the chords regenerate. This is after a year, the chords have totally regenerated. But many a times people use the false chord to produce voice, as you can see here. It is important to understand in which case the voice is produced because of what. As you can see here, this patient has got a right vocal fold cyst, but his voice is really bad because he is using his false chords. Similarly, in this case, the patient is using his false chords. As you can hear, the voice really becomes bad when the right false chord touches the left true chord. It's a very common tendency for us to label everything as GERD. But see here, the patient's left chord is not working, and what you can see here on the arytenoid is the ulceration which has happened because of the overactive right chord, the right arytenoid hitting on the left. If you can see, in this case of intubation granuloma, in spite of these two big bumps on the arytenoids, still the mucosal waves on the membranous chords are very well visible. So a paresis and a paralysis of the chords must be kept in mind. Like this case, whenever dealing with a case of hoarseness. You can see that the left chord here is paralyzed. So there is a big phonatory gap.
मेरा नाम एवी पंत है। मैं पिथौरागढ़ उत्तराखंड से यहाँ आया हूँ। लगभग 1 साल से मेरी आवाज़ ऐसी हो गई है।
And this is after surgery, a thyroplasty. The phonatory gap is closed.
मेरा नाम एवी पंत है। मैं उत्तराखंड पिथौरागढ़ का रहने वाला हूँ। मेरी आवाज़ 1 साल पहले कुछ खराब हो गई थी।
It's very important in professionals not to jump onto what you see. As you can hear, this singer, in spite of the hemorrhagic cyst in the right vocal fold, is able to sustain her notes. So we'll give it a full chance to resolve. To prevent victims of surgeons. This patient, who was an orchestra singer, was operated twice for vocal nodules which were probably soft earlier, Now the vocal folds look clean and good, but the voice is bad. Let's see what common mistakes the professional singer and actors commit. As we have seen that we need to pump a lot of air out from a small chink in order to produce sound. And in professional singers, a lot of air has to be pumped in and pumped out to produce a good projection of the sound. So the situation is like this hose pipe from which the water is flowing from a big reservoir. If we need to go further, we need to increase the volumes. And in case of singers, the importance of breath support cannot be overemphasized to produce a very high quality sound. We have with us my friend Mr. Abhijit Ghoshal, who is a playback singer. He will demonstrate to you how proper breath support is required to produce a good sound. You saw how effortlessly he could sustain the note for so long. But if there is not proper breath support, then what will happen? The singer will squeeze her throat out like this. See what happened? If it did not retain the full breath inside, then he could not sustain for long, and his voice was also very thin. That's what happens. And see what happens inside. Everything has squeezed. Many of the untrained singers are like kids. They want to reach the heights beyond their limits. So they press hard and they squeeze hard. They misjudge themselves and land up into soup. This is a big hemorrhagic nodule on the chord of a singer. Many of them develop muscle tension dysphonia. The result, you can understand. So the sound which is produced by the vocal folds or the vocal cords is the raw sound. There's a lot of sculpturing required, which is done at the level of the nose, the pharynx and the sinuses, and the articulation of the final sound is done by the tongue and the lips. As we know that the quality of the sound of any musical instrument is decided by the resonant chamber. So every individual has a different resonant chamber and has got a different voice. What happens during an episode of cold or sinusitis is that this whole resonant chamber is full of fluid. Just imagine filling Ustad Zakir Hussein's tabla with water or filling this instrument with water. What will happen? A really bad sound. But there are instruments which are based on water only, like this Jal Tarangam. It works on different quantities of water put in different bowls, and each bowl has a different frequency. So what I mean to say is that every singer or every actor's voice is unique based on his own configurations. Now vocal folds are very small and the oral cavity is quite big. So the ratio acts as a loudspeaker. As you can see here, the small sound source is amplified by this loudspeaker. If you happen to block the mouth of the loudspeaker, how will the voice come out? So it's very important to keep the mouth open while singing. Abhijit will demonstrate you an example. Now the position of the jaw really plays an important role in what kind of voice is going to come. Abhijit, can you demonstrate the position of the jaw for different kind of...
Yeah, I'll take three positions. One is the jaw is inside, like this. One is normal, and one is, it is all very crammed up. मिले सुर मेरा तुम्हारा तो सुर बने हमारा. Now the normal. मिले सुर मेरा तुम्हारा तो सुर बने हमारा. मिले सुर मेरा तुम्हारा तो सुर बने हमारा.
Great. So this was about the jaw position. And it's important to keep the tongue in a way that the area of vowel articulation and the area of consonant articulation are taken care of. The usual position of the tongue should be just inside the incisor teeth. Let's understand a very interesting concept of hyponasal and hypernasal. If somebody has a bad cold, his voice becomes hyponasal. That means he talks like this. On the other hand, if the palate is not working well, or if somebody has a cleft palate, the voice is hypernasal. He is talking through his nose more. I'll give you a very interesting example. Out of A to Z, the letters you can see here, I'll say A to Z closing my nose. A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P, Q, R, S, T, U, V, W, X, Y, Z. As you could see, out of 26 letters, only 2 letters M and N were disturbed when I closed my nose because they are the nasal consonants. But let me say a complete sentence by closing my nose. Can you hear my voice? My voice is really bad. Out of the 26, only 2 are responsible for 40% of the nasalence. Nasalence is the nasal sound, which is 40%. So out of 26, only 2, M and N, are responsible for the nasalence, which is around 40%. So nasalence is something which is unique to everybody and which can be changed over time. It's a product of the palate and the sinuses taken together. And the singer's voice is more of a style, it's more of a mannerism. If we take the case of a famous singer, Hemant Kumar of the yesteryears, you will remember he used to sing with the lips closed. So if we take one of his songs, he would sing it like this. ये रात ये चांदनी फिर कहाँ सुन जा दिल की दास्तां. If the same song was sung by Mukesh ji, he would in his characteristic style open his mouth wide and add some nasality to it and sing it like this. ये रात ये चांदनी फिर कहाँ सुन जा दिल की दास्तां. And if the same song was sung by the legendary Kishore Kumar, he would sing it somewhere like this. ये रात ये चांदनी फिर कहाँ सुन जा दिल की दास्तां. So everything counts. It's the same voice, same vocal cords, but the style changes, and the style is a combination of different factors. Another very important thing for singers to sing in the falsetto or the false tone. Abhijit, can you tell what is falsetto?
While we are singing, we can go up to a certain note in our normal voice, like sa re ga ma pa da ni sa. This is normal note. Sa re ga ma. After this, you have to go in false. Sa re ga ma pa da ni sa pa ma ga re sa. Sa re ga ma pa ma ga re sa ni da pa ma ga re sa. This
Is the
this
falsetto.
is a false note.
So during falsetto, what happens? the vocal cords become very thin and they are spaced apart and the air flows through them like this. What kind of a problem does it create to the vocal cords of a singer?
It's like you have to stress out a lot, and there is too much of air usually come. There is a continuous air. So if we keep on singing like this, the voice goes bad.
Right. Abhijit, can you tell us a little about chest singing and the head singing?
In Indian classical system, we call it kharaj and upar ke notes. So kharaj is the and head is
Right. So if you say Om, this is chest because your chest is vibrating.
yeah.
And if you say Om, this is your head is vibrating, so it's head note. Okay. Another thing is vibrato, a very, very common attribute in both Indian as well as Western singing. Can you give us what is vibrato and can you give us an
vibrato is when we oscillate between two notes like sa ni za ni za ni za ni za ni za ni za. It's a very fine oscillation.
Can you give an example?
O sathi re tere bina bhi kya jeena tere bina bhi kya jeena this na. An extreme form of this we also call it tremolo, that is usually not sung. It's Ya Devi, if we sing it like Ya Devi Sarvabhuteshu, that is extreme oscillation.
Right.
And another one is staccato, like it is more of that Kapalbhati.
You use a sound.
Where we use our stomach to.
Can you give an example of a song?
The song is Jana, Jana, oh meri Jana, अरे मैं हूँ तेरे ख्वाबों का राजा, अरे लैला, this is not लैला, लैला, la. So this is a sort of singing where abdomen has been used.
And this can also injure the vocal cords of a non-trained singer.
Non-trained.
Right, yeah. Right. And see what happens onto the vocal folds and the pharynx. In vibrato, the pharynx is contracting.
Yeah.
At a particular pace, right?
You need proper practice.
Right. So now let's come to the common myths and queries that singers can have, singers and voice professionals can have. Abhijit, what are your queries?
Doctor, the first thing, whenever we have any problem with the throat, sore throat, or whether we know about the vocal cord problems or not, we are supposed to take gargles. We do gargles, everybody
Right.
does. So is it advisable or does it reach the vocal cords at all?
I'll show you a video. This shows that the person is drinking. Here it's a contrast. But whenever the person drinks, it never reaches his vocal cords. In fact, if you are drinking something and it touches your vocal cords, you will cough.
Yeah.
So the gargle never reaches the vocal folds. So it will help in your throat, pharynx, tonsils, but it will not help in your vocal folds.
Okay, if there is tonsillitis or swelling in tonsils and all that.
Right.
And the thing is, many people, the seniors also, they ask you to not to drink milk products before program or something. Warm milk or something, acidity will.
Unless you are allergic to milk and milk products, drinking milk or using any milk products before your program is not going to be a problem. Coming to medications that one can use. Many a times singers and actors, if they are having any common cold, they take cetirizine or any antihistaminic. What antihistaminics do, they, in addition to drying up your nose, they also dry up the throat secretions. Therefore, the vocal folds become dry. And because of dryness, the chances of damaging your cords become more. So, giving a mild steroid spray or tablets in a very small form is actually more advisable in a professional voice user than giving antihistaminics. But obviously, abuse of steroids leads to all kind of problems that you are aware of. Voice abuse is the most common cause of problems in the singers. Abhijit, don't you think that many a times in parties,
we keep
on
shouting
roadside,
and talking,
and in airports, even in classes?
Yeah. Without microphone, these guys are singing and everybody has to exert more.
Right. Back room, green room, backstage, cheerleading, and even teaching. You exert your cords. This is voice abuse, and what finally leads to a situation like this.
Many a time when we have voice problem, we tend to speak in a whispering voice.
So even whisper is not fully safe, because while whispering, your cords remain apart but the air escapes through them at a very high velocity. When you speak like this, you have to exert more.
Yeah.
So the vocal cords are, though they are not vibrating completely, but they are still not taking complete rest. So if you have to take voices, take a voice rest, or you speak in a normal tone like this.
Yeah, and another thing is, many times singers do in the mid of singing.
Right. This brings the issue of vocal hygiene. So what is vocal hygiene? Don't shout. You can speak loud like this, but don't shout on the top of your voice beyond your range. And throat clearing is a very important issue. When you do this, you are actually rubbing the cords against each other. So it's better to gently cough right, like this, rather than scratching your throat, right? So whenever people present us with voice problems, we prescribe voice rest. But how much voice rest? Should it be this much, or this much? So how do we decide? Now this is a field which is still controversial, but if someone is presenting with a simple infection without any signs of a vocal fold bleeding, you can go with a mild to moderate voice rest. But if somebody has a vocal fold hemorrhage and you can see that clearly, then it is better to give a good 2 to 3 weeks of voice rest so that it does not organize and lead to a bigger problem. The allergy and sinuses. Again, a very, very common problem with the singers.
Sneezing. Continuous sneezing in the morning, or in case you are exposed to any fume or dust.
And your lifestyles are also like, it invites a lot of allergy and sinusitis. So it's very important to treat the allergy, and if at all required, clear up the sinuses, because that will ultimately lead to throat clearing, constant cough, and a problem with your vocal cords. Many times people come to me and ask whether I can have ice and cold drinks. It is an individual thing. If a person has a sensitivity to cold and he develops a sore throat after having cold, then he is not supposed to have, but otherwise drinking cold is not a problem. One thing I wanted to stress here for my ENT colleagues is that singers like you, whether you have a tonsillitis, pharyngitis, anything, you will always complain of a sore throat, if it's vocal cord or tonsils. So what is important for us as ENT doctors is to diagnose that we have to differentiate between a large tonsil like this versus a tonsillitis which is a bacterial infection like this, versus a aphthous ulcer on the tonsil like this, versus a tonsillolith, which is like this. These all are different conditions and the treatment is entirely different. Besides this, a vocal fold problem has to be distinguished from a postnasal drip versus a chronic pharyngitis because of allergy, because of pollutants, because of acid reflux. These small issues have to be really differentiated, especially in case of voice professionals like him. And definitely it is important for us to advise them to eat proper food in proper time, not to abuse food, especially if they are having acidity, use of alcohol and smoke. The combination of acid reflux, alcohol and smoke really gives a damage to the vocal folds. And if we look at the vocal folds look normal, but the arytenoid area, the area behind it, you can see it's all red. Though it never damages the cord per se, but then it leads to that scratchy sensation in the throat, for which you have to do
all the time.
And that damages the vocal fold. There is an issue about aging and singing voice. It has been clearly seen that with normal aging there is no change in the voice unless the person is of 70 to 80 years of age, when the general muscle atrophy starts, and at that age we can expect some atrophy of the vocalis muscle also. In females, however, with menopause and changes in the hormones, the aging is much more pronounced. A very common problem with young female singers is that just before the menstrual cycle, because of the change in hormones, the vocal cords become quite congested. So their bass note goes down by half. And if they try to really sing very high notes, they can have a bleeding in the vocal cords. So they have to be aware of this possibility. So what is important is to not keep the throat dry and keep on having a regular riyaz and warm-ups before they start. Abhijit, can you stress on the warm-ups, which is...
As an athlete needs warm-up before his sprint, similarly we also need warm-up. And once the muscles are toned to produce that, like every singer, every classical singer more particularly, they practice for at least 30-40 minutes before their concerts. So that is very essential.
Yeah. Only thing I would like to add here is that if the warm-up time in the mornings is more than say half an hour, it is indicative of a gastroesophageal reflux, acid reflux. The importance of good sleep can never be overemphasized, because a good sleep gives you the energy which is required to sing fresh rather than sing long, to sing fresh. To operate or not to operate. As a singer, Abhijit would be very scared of any surgical procedures on his vocal folds or the sinuses. But let me tell you that any surgical procedure, if required in a non-vocal performer, will remain the same in a vocal performer also, provided you understand the problem and you absolutely remain in a boundaries. That means you do not go through the deeper layer of the lamina propria, you respect the vocal ligament, and the surgical principles remain the same even in a voice professional. Abhijit, can you tell me the right age to start singing?
What I have seen, singing is one capability that is given by God. That is one thing. If somebody is that good, he or she may start singing at the age of 2 and 2.5. But otherwise, a proper age is 5 years onwards. Till then, the parents can make the kid listen to good music, and if they feel that the kid is just too much interested in listening to music and singing as well, they can put him before 5 years also. Otherwise, 5 years, 6 years onwards is a good time. The most important is not to sing during that 12-13 years transition period.
Puberty period.
Puberty period, voice is changing. That time you have to be very cautious what you are singing. That time you have to have a good guru.
Can you tell us a little about the stage setup and monitors, especially for...
Most important factor for us. Without monitors, we tend to exert much more pressure than what is needed. If the monitoring is good, monitoring is nothing but the fold back monitors, they give you precisely what you are singing, they give you that voice, that sound. So it has to be very properly done, otherwise you sing just with too much of pressure, and that leads to more vocal cord problems.
There's a long way to go still in the vocal science. We are still quite behind. As you can see here, this is the high-speed photography, which shows that not only the vocal folds vibrate, but the whole larynx vibrates. This is something which we have never seen before, and definitely there's a long way to go, and we have to learn from them, they have to learn from us, and we hope that we'll see a better tomorrow, especially for the voice professionals.
Doctor, actually on behalf of all the voice professionals, I would like to thank you, because the problem in India is like what I have seen, most of the ENT doctors, they are not singers. You are a very good singer, so you know the problems of us, our community, and most of the singers, they don't know how the voice apparatus works, how the voice is produced. Everybody is undergoing, like, has been working with all these myths. Ye mat khao, wo mat karo, don't use this, don't use that, don't sing on these scales. Nobody exactly knows, nobody exactly wants to know. And I'm so very thankful that you have shared this knowledge of voice and the production of voice, and this whole process. I have learned a lot, and I'm very sure that this CD is going to be an asset to all of us as well as all of the ENT doctors.
Thank you.